You're going to be a good boy, huh? I said, we look at your ears. Mom, you need to put him on your lap. Okay.
Ear infections are very common in young children, particularly between the ages of 6 months and 2 years.
Other side.
This is the outside portion of the ear, which you can see, and then we have an ear canal which goes down to your eardrum, which is sitting in here. In behind the eardrum is a space here called the middle ear. I'm taking this bone away, and this bone is what separates the middle ear from the brain. There is the inner ear and the balance apparatus in here and the nerves of hearing, but most importantly attached to here is the eustachian tube, the tube that runs to the back of the nose. It is in this area, in the middle ear, that children get ear infections. The symptoms can be sort of quite difficult to discern for a parent. Often their children are just irritable. Sometimes they can be pulling at their ears, tugging at their ears. Occasionally, if you've got a good going ear infection, you can actually burst your eardrum, so you will have some discharge from the ears. But often it's difficult for parents to know. There are more subtle signs. Sometimes parents are aware that their children fall over a little more because it can interfere with their balance as well. Obviously, older children will tell their parents that they've got sore ears.
Generally, most children's ear infections, they will just go away. Bit of Pamol, bit of ibuprofen, towel them down, keep them cool, and you just got to take care of the pain and the fevers. If it's going on for 3-4 days, then you're starting to think, actually, maybe we do need something for this.
In the old days, it was always treated with antibiotics. These days, we're treating less with antibiotics. We would recommend that the under 2s should get antibiotics routinely. The older children, we may hold off on the antibiotics unless things don't settle down quickly. Hi, Luann. Hi, Corbin.
When an ear infection clears up, but the fluid remains, this is glue ear. This sticky fluid interferes with the eardrum, affecting hearing.
It changed from when he had his grommets.
Luann discovered something wasn't right when Corbin, at 17 months, was saying very little and was reluctant to start walking.
We've had a few sleepless nights, fluid behind the eardrums, ear infections. Took him for a hearing test and that confirmed that he had fluid, so I took him to see Colin Barber and he treated him and referred him for grommets.
The grommet is just a little plastic tube that takes over the function of the eustachian tube. So what we do is we make a little cut in the eardrum, pop in a grommet. That allows air to get in the ear, which usually prevents most ear infections. And if you do get an ear infection, it allows the infection to get out of the ear. Now, we can have a little peek in your ears.
Simple things you can do to help prevent ear infections are to provide a smoke-free environment and breastfeed your baby.
We haven't had a problem since. No sleepless nights. He's talking more. He's great. Yep, very happy.
And that grommet's sitting beautifully in that ear too. That is fantastic. Should we go back and play with the toys? I think the one message I would say is if you think your child isn't hearing, ask for a hearing test. There are a number of children born in New Zealand whose diagnosis of hearing loss is picked up late, and we would like to pick it up early. There is no age at which we can't test the hearing. We can test a hearing from a newborn child. So if there's concerns about hearing, ask your doctor. Press your doctor to make sure you get a hearing test.
Raising children's here to support you, but there's much to learn as a parent. So make sure you seek further advice and help. A good start is a social service agency, an early childhood education provider, or a health professional.
This is made by Raising Children Media.